Demi Moore, a talented actress who, like many Hollywood stars, are trying to retain their youthful appearance. However, at times I think she's verged off into an area that makes her look actually worse. So here we see Demi Moore in 1981 at the age of 19. She hasn't had any surgery or any cosmetic interventions at this point. We can see from this point on how she will evolve as an older woman. But at this juncture, she has perfect skin. Her nose is small. Her eyes are penetrating. Her brow position is ideal. And her jawline is well defined. And now let's take a look further on in time. So in 1982, we can see that she has a little patch of hair loss or thinning at the widow's peak. And this widow's peak hair loss actually gets greater several years later. In 1987, we can see that she has this larger patch of hair loss. And hair loss does occur in some young women either due to androgenetic alopecia or hormonal changes that may occur over time. And there may be some unknown reasons why women lose hair at this age. So in 1990, when she's now 28 years old, the contour of her face changes slightly. I mean, she had kind of a rounder contour, a fuller face, fuller cheeks when she was younger. And now she's starting to get a little hollow, slight hollowness to the mid-face area, slight hollowing under her eyes, and obviously her hairstyle has changed, so it gives her a totally different look. Other than that, she doesn't look like she had any surgical interventions at this juncture. Then at age 30, we can see that she really, again, doesn't look like she's had any surgical or cosmetic interventions. She does have a little bit of subtle hollowing under her eyes at this point. She's 30 years old. She's starting to show a little bit of fat redistribution of her face. So in 1997, I see some hollowing of the temples. There can be fat loss in the temporal region here. That can be sometimes induced by Botox injections, by the way, which can cause some muscle atrophy in this region, but it may just happen naturally over time. And 1999, I see no real changes either. So in 2001, you can start to see that Demi is starting to address the hollowing of her lower eyelids. She's trying to create this continuity between the lower eyelid and the cheek, which is a sign of youth. And I don't know if she's had fillers or fat or some other means of filling that in. I don't think it's just purely makeup. I think it looks like there's some volume enhancement in this photograph. In 2003, we clearly have an image of her smiling and showing off her veneers. She has perfect looking pearly whites, and it looks like a very good job because they look very natural in appearance. In 2008, we see her smiling, and we can see that her cheeks look very full. It's very possible she has some soft tissue augmentation with either fat or artificial fillers. Probably done a little bit too much, especially in the inner aspect of her cheeks, so it looks a little artificial. 2009, I don't see a lot of change, except that it does look like she lost weight. Her face looks thinner, and her cheeks look very similar to her prior photograph. 2010, we can see that her face, 1 year later, looks a little bit wider, broader. It's possible she's getting more fillers placed in the lateral portion of her face, creating a more rounded appearance. Her upper lip is very thin. She has a slight gummy smile, and it's interesting to note that her lip looks a lot thinner than it did only a few years before this. So it's possible she previously had a little bit of filler placed in the upper lip to enhance the volume of her upper lip previously. Now she's going to kind of abandon that and now has gone with a more natural lip volume. So this is Demi at the age of 50, and what we're seeing in this three-quarter view is laxity of tissues underneath her chin. We're starting to see these little bands appear. These are platysmal bands. This is the muscle underneath on her neck that starts to splay apart as we age. And in your late 40s and 50s, they start to appear, and a lot of people are very concerned about that. They don't want to look, quote, old at this point, so they could come and discuss what can be done with me regarding those bands. And usually that requires a lower facelift, not necessarily an upper facelift, but a lower facelift can be done to tighten those bands. And this is a very common procedure that I perform in people of that age. Okay, in 2014, I want you to all notice that she has a fullness in the buccal area right here. And but in 2015, she's lost a lot of weight, and now she has this atrophy that's extending from in front of her ear all the way to towards her mouth, and particularly the buccal recess here. It looks like she's had some buccal fat removed, and there's some hollowing, and this hollowing has actually created a much older, gaunt look to her face. So it actually was very detrimental in terms of her appearance, I believe, in terms of making her look younger, and makes her look older. So 2017, we can see this accentuation of this hollowing of the buccal recess here, and on an additional photograph we see on the lateral view that there was some kind of manipulation along the nasolabial line. There's like this disturbance of the line itself. Maybe they did liposuction. I don't know what they did exactly here to maybe raise the line. I don't know exactly, but it's weird. And in addition, you can start to see these three hollows. So there's a hollow of the temple, there's a hollow laterally, and there's a hollow of this cheek. It's really an age-related look, and she's really setting herself back in terms of not appearing more youthful, but much older. So 2019, I see two interesting features here. One is that she has what's called lid retraction. So her eyes are a little wider, the aperture of her eyes are wider than normal. The eyelid, the upper eyelid, should cover about 1 to 2 millimeters of her upper iris, and they're actually wider than normal, which can sometimes indicate that she has an underlying thyroid abnormality. And in addition, her face is very asymmetric, so it looks like people are trying to do facial augmentation, again with either fat or hyaluronic acid gels, to inject into her face to compensate for the previous hollowing that she encountered just a year or two before. It's making her look older. In the year 2020, you start to see that her face is starting to look a little more symmetric, so they're straightening out these fillers that they put in, and it also appears that she had a facelift at this point, because I don't see any banding of her central neck, especially on a profile view. You don't see those platysmal bands anymore, so it looks like she had a facelift to compensate for some of the age-related changes. In 2021, she actually looks worse now, because it looks like she went back to filling her cheeks, and they put way too much filler in both the cheeks, especially the central cheeks, and she has this oblong filler in here. The look was actually accentuated because she had a facelift as well. So when they pulled it up, it actually created this kind of a Joker look to her face. It really was not a very positive way to enhance her appearance, and actually made her look much, much older. I also think that she had filler placed in the upper lip, which is causing the lateral portion of her lip to descend, and by doing that, it creates this kind of sad vector, this downward vector that creates this like appearance that we're sad in a sense. That again was not a positive move on her part, or the part of her doctors who were taking care of her. Three-quarter view in 2023 again shows this overweighting of her mid-face and the sagging that's occurring due to too much filler placed in the mid-face. It shows you that over time, some of these fillers, if they're taken to the extreme, can really do a lot of damage in terms of your appearance rather than enhance your appearance. So you got to be very conservative about how much filler you're putting in to enhance your appearance. I believe you can do small amounts and get away with it, but once you pile more and more on there, pretty soon it goes in the other way, in the other direction, and it's hard to sometimes even dissolve all that stuff. In 2024, you can see she's about 61 years of age, and Demi has, again, this asymmetry, large amounts of filler placed probably in the mid-face, asymmetrically juxtaposed against these hollows. It just makes her look so old. It doesn't enhance her appearance at all. And I think that, unfortunately, some people go down the road and for correction, and they can't seem to get back to where they started, and it gets worse and worse and worse. And nobody is really guiding them in terms of how to get out of this bad cycle. And unfortunately, people just deteriorate, in a sense, their appearance. The real lesson here is that you have to go to people who have your best interest in mind, and not necessarily give you everything the way you think you like it. You have to hear objectively, what is the best solution for your problem, and sometimes that is difficult to achieve. And there has to be kind of a meeting of the minds and a good assessment of what someone really needs in the end. I hope you found this analysis to be of value, and sometimes less is more. Subtle improvements sometimes trump more exaggerated improvements, and in the end, you have to go with a very clear image of what you want to achieve. Don't go for the most exaggerated appearance, because sometimes it'll make you actually look older, not younger. If you have any further questions, please leave them below. I'm more than happy to respond to you, and I look forward to seeing you in my next video.